When they boost your cocaine, don't you know what to say?
After having listened to Supervisor Campos, and I want to step back for a minute. I think everybody knows this, but if you don't, you need to. Supervisor Campos has been the absolute most prominent champion of healthcare services, of healthcare as a human right, of vigilance about people's access to healthcare in San Francisco on the Board of Supervisors. And without him, there would have been God only knows how many backward steps, not only in the Healthy San Francisco program, but in the delivery of services and the maintenance of the public health system in the city over the last number of years. So thank you, Supervisor Campos.
Maybe we should send him to Sacramento.
Oh, that's a good idea.
You may be able to talk about that after. When I think about this, it's in some ways it's easy for us to tell ourselves a story, which is that we had a clear vision of what we wanted to achieve, and we fought for it, and businesses were all on the exact opposite other side, and because of superior organizing and great leadership from various individuals, we were able to achieve these extraordinary breakthroughs. And some of that's true, but a lot of it is a little bit more messy than that. There are a lot of unintended consequences along the way, a lot of opportunities that a lot of problems, shall we say, that the business community brought upon itself, and that we took advantage of because of a dedicated group of smart activists like yourselves in the city. So what in the world am I talking about? I mean, let me back up all the way to 2006. I don't know if some of you do remember, others might not, just because so much has happened. I mean, the healthcare security ordinance dates back to 2006. This is 8 years. This is not yesterday or the day before. It's a long time now. Don probably remembers this because he has stuff like this etched in his mind. Where the healthcare security ordinance started was with something that a lot of people in this room wouldn't even support and might have thought was a step backward, which is it was a local version of pay or play. At a time in which a lot of single-payer activists thought that any discussion of pay or play was actually a sellout, and a diversion.
We did. We
Well, no,
I
I know, but it's a complicated process. The Labor Council approached Supervisor Amiano, very much like his successor, Supervisor Campos, was the champion of healthcare rights on the board, and said, look, we want to move a pay or play ordinance here because we think, like in many other things, San Francisco can set a standard for the nation that will, in large measure, just to be clear, this ordinance, when it began in its infancy, was just as much about stopping substandard competition to good employers by cutthroat businesses that weren't providing employees benefits as it was about expanding health care. It started out as an employer spending requirement. There was not a universal health care program attached to it at all. It was about pay or play. Something interesting happened, and you're going to hear, that in some ways what just happened over the last few months is a repeat of the past in a strange way, because luckily the other side didn't learn their lesson. What we were doing, with Supervisor Amiano's, capable leadership, was gaining steam. And it was clear that some version, you have a question?
Yeah, I'm just curious, pay or play, I don't get it. I understand the pay part, but what was the play?
Pay or play was, a phrase that was used to mean employers should either have to provide insurance to play, or otherwise they should have to pay money that could be used to provide health care to their employees by some other means, right? Usually by some form of government program. Anyway, it was clear that this was gaining steam, and the business community was very nervous about what would happen, what might get passed. Could it be somehow, blunted, if not outright defeated? And something funny happened along the way, which is the Newsom administration decided on an interesting sort of sideswipe, which was to do the following. So, well, they're going to pass something that's likely to make people pay. We gotta ensure that they get something for it. And besides that, if we define what it is that people should get, then whatever it is that then we can have a debate about how to pay for it. Let's shift the debate away from employers paying their fair share, right? And what did Gavin Newsom do? He established something, will sound familiar to you if you've been watching the news for the last few months, called the Universal Health Care Council. Sound familiar? Yeah. Right. It was the progenitor group of this shadow of its former self that we saw over the last few months. And this was a giant, if you'll excuse my language, a giant clusterfuck of dozens of interests all gathered around the table. It was run by, corporatists is a kind word. Sandra Hernandez, who then was the president of the San Francisco Foundation, former director of public health, who was brought back for this current council, and Lloyd Dean, who was the CEO of Catholic Healthcare West at the time. And, there was a huge number of people on that council, including Sandra Hernandez, very aggressively, who thought that the problem with the healthcare system in some way was people like us. That we had, a concern for outmoded systems of comprehensive care that really avoided what was transformative and could provide a better model by, focusing on access to primary care services and not larding down everything through the government. I mean, she was interested in, and I'm not making this stuff up, I mean, this is very real. She was interested in exploring things like, whether, we could stimulate more, storefront clinics in drugstores, right? I mean, there are people who wanted nothing of a universal healthcare program. The person who convinced, everybody that, the natural evolution of this push by Supervisor Ramiano was to a universal healthcare program was the former director of public health, Mitch Katz, who, and Ed can share some stories in the, when we get into the discussion period. Not everybody always agreed on everything with Mitch Katz. But on this one, he saw something that other people didn't see, and it was the following, that the money, San Francisco has this long history of being very committed to people's health care and spending an enormous amount more money, public money, on healthcare access than, per person than any other county in California or any place in America. He saw that money could be used in a different way to provide organized care to people instead of just funding indigent care that was random based on people addressing their illnesses as opposed to being involved in a system of services with a medical home at a clinic and access to particular hospital providers and so forth. And he convinced, there was neither of them would use terms like this, but there was a little bit of a knife fight between Mitch Katz and the man who was then and still is the chief of staff to the mayor of San Francisco, Steve Cava, about how this would evolve. And Mitch basically worked quietly with a number of us in the activist community to process the idea of this universal program through the Universal Healthcare Council. And so, it was clear at the end of this process there was going to be this program, Healthy San Francisco, that was, by US standards, very revolutionary and, a real breakthrough. And it still, at that moment in time, wasn't decided how it was going to be paid for. Now, by the way, I wanted to say something else that many of you know a lot, I don't know. As I was saying before, the vast majority of the money in Healthy San Francisco was already there, right? There were millions more added to providing healthcare services to employees through the healthcare security ordinance, but the bulk of the money that ever went into Healthy San Francisco, more than 4/5 of it, was already in the system, right? So we were still fighting for all the reasons that I laid out at the beginning about evening the playing field between better employers and worse employers and stopping, downward pressure on wages and benefits for working people to make sure there was a healthcare spending requirement. And Steve Kava, you're going to hear like the repeat version of this in a second. Steve Kava was against it then, he's against it now. And, there was all kinds of bizarre maneuvers by the business community to try to figure out a different way to do something that would add some money to the pot. The final offer that they actually made, people will love this. Let's not have this, healthcare spending requirement for employers. How about an increase in the business license fee, right, to raise the same amount of money, which, basically amounts to the biggest businesses in San Francisco fobbing off more burden on the huge number of sole proprietors who are artisans and whatever in San Francisco to pay for the healthcare for their employees. Well, luckily, at a certain point, we got an 8th vote. To overcome a mayoral veto on the San Francisco Board of Supervisors, you need 8 votes. Well, subsequent to a lot of very heavy lobbying by his district, various of his district Democratic clubs, both more progressive and not so progressive, by active healthcare activists in the LGBT community, probably by some of you in this room, then Supervisor Bevan Duffy committed and was the 8th vote. And at that point, we had it. And we didn't really have to negotiate anything, but we did anyway because a lot of the people watching this in the labor movement wanted to try to make it a model that could be replicated elsewhere. And so we actually worked with the Newsom administration to a point where he could embrace it as his own, right? That's how we got where we got. Well, fast forward, and I will do this much more quickly because you've already heard most of it from Supervisor Campos. Fast forward 8 years, and the Affordable Care Act is passed, and it's sort of like, you ever watch those old Warner Brothers cartoons where like Wile E. Coyote gets an idea, sticks his finger up in the air, right? Well, the Golden Gate Restaurant Association and Steve Kava, had that Wile E. Coyote moment. Now we can destroy this program. Now we can get rid of the employer healthcare spending requirement. Obamacare is already setting an appropriate standard. Why do we need anything more? And so they stepped on the gas, and thanks to diligent work by Supervisor Campos' staff and others, we learned just how advanced their thinking was about trying to dismantle this program. And many of us who worked on the original legislation got engaged immediately and succeeded to monkey wrench it. The administration had hoped to get a ruling out of the city attorney that the program was actually preempted under federal law after the passage of the Affordable Care Act. The city attorney, and his staff found very differently. Well, okay then, I guess it's not illegal. What can we do now? A couple of things. One is let's convene this Universal Healthcare Council to have another debate on exactly what kinds of cuts can be made. Right? There's never a debate about how to improve the program. That's not what the administration wanted. And let's also try to figure out a way that what the activists want, which is more money moved out of these health reimbursement accounts into the city option, can be ruled illegal even if the program as a whole can't. So that basically, a lot of the improvements we might want were going to be moot anyway. And, over the last few months, what you've seen play out, once again, I think it's in a funny way, it's a farcical repeat of what happened 8 years ago. They set out to set up this whole process to undermine this program, and on the other end of it, we've arrived at a point where we are in the driver's seat to improve it, right? They set themselves up with this expectation. You may remember, you may have read it in the Chronicle or heard it on the news, Mayor Lee coming out and saying, it's our administration's position that, everybody, we need to do everything we can to get as many people possible to have health insurance. Well, you know, what we demonstrated irrefutably, to a point where they wouldn't even fight it, is that unless the money that was made available by the healthcare security ordinance was both continued to be paid by employers and organized into, you know, vehicles that were accessible for the purposes of buying health insurance, that a lot of people weren't going to get health insurance. I mean, just to give you a sense of like concrete numbers, the projections by the best, government-supported and funded projection process about who is going to take up health insurance under the Affordable Care Act of California, they say that 5 years out from now, in 2019, under the best case scenario, still there will, excuse me, there will be as 40% of the people who qualify who won't take up insurance. And under the worst case scenario, it'll be almost 50%. Right? So suddenly, Mayor Lee's mantra about, Mayor Lee's mantra about let's get everybody insurance, our program that he wanted to kill, became the solution to his own problem that he posed. And, to fast forward even further and end, where we are now is with this interesting conundrum. The old loophole doesn't exist anymore. These HRAs as they existed in the past aren't legal, right? But there's a new loophole. The accepted benefits HRA that Supervisor Campos explained. And the city is already backpedaling on this. We forced the city into obeying its own law, which says that expenditures only count toward the employer spending requirement if they are reasonably for the benefit of the employee. Because their initial position was that employers should be able to put as much money as they want into these accepted benefit accounts. So for example, if you were a 40-hour employee working 2,080 hours a year for a company with, more than 50 people and were getting $2.44 an hour, you would have something like $3,000 put into an account that you really couldn't use for much other than dental vision or long-term care benefits, which we all know are a giant ripoff anyway, right? And because we pushed back on that, they narrowed that down. Not enough, but the point of the matter is, they know this loophole is going to close now, right? As long as we don't let them off the hook. They know it's going to close. And